you have almost achieved everything in dental, whatever we can think of.
And I'm still a keen learner trying to understand.
Do you think there is any similarity between the academics and the clinical practice?
It's not a similarity, I would say, but a contrast rather than a similarity. I would sadly say that the academics has not been able to keep pace.
There are so many clinics being shut down within a year of practice. Do you have any comments on that, sir?
As a BDS pass out or MDS pass out, you should give certain time, acquire some other skills as we discussed, and then you should start.
Is it true that one should make the mistake and then only learn, or is there a shortcut to that?
Someone who has not made a mistake in life and has been successful might not be the good role model. The good role model would be someone who has tried 10 different things, failed, and then succeeded.
Dr. Keval Shah, alumni of Government Dental College and Hospital, Ahmedabad, one of the founders of first chain of dental clinics in Gujarat, Fine Feather Dental, currently the executive managing director of same. He was professor and PG guide at Ahmedabad Dental College, and when he left, he was vice principal looking after academics. He has extensive experience in running a private practice, has traversed across the entire dental spectrum, right from handling and sourcing the patients to understanding the functioning of dental laboratory and a dental trading company. His vision is to bring oral health at par with overall health and create a better dental practice for society. How do you feel, sir? You have achieved everything in dental industry.
I still feel that this is just the beginning, and that's how I keep myself motivated to learn and improve on a daily basis, on a monthly basis, on a yearly basis. But thank you for the wonderful introduction, Doctor.
I think that is the key to success. Always there is a hope to learn more.
Yeah, the zest to learn more, to contribute more and be a better person than I was before.
Amazing, amazing, sir. Dr. Keval, you have seen the best of both the worlds, be it academics or private practice. Do you think there is any similarity between the academics and the clinical practice?
So, come to think of it, it's not a similarity, I would say, but a contrast rather than a similarity. The dental profession as such has evolved very dramatically, and especially so in the last 10 to 15 years.
Yeah.
The changes that have come into the dentistry are amazing, and I would sadly say that the academics has not been able to keep pace with that.
Yeah.
The skill sets acquired by the dental surgeon in the schools, dental schools, are woefully short of what the need of the dental profession currently is. If someone who is a budding dental surgeon who wants to start a practice, who wants to open a clinic, he would need to bridge this big gap. Only then he'll become a successful dental practitioner.
Right.
So the dental practitioner, become a dental practitioner should be the goal, and not just getting the degree from the
Definitely.
school. Right? So I believe there is a big gap which needs to be bridged.
As the technology has developed
Yes.
in the country,
You're absolutely right.
it has moved to dentistry as well, and there are a lot of new technical things.
Absolutely. The digital advancements are amazing, and what implants has done to dentistry is amazing. Maybe 20 years down the line, even implants might become like defunct, and
Yeah.
that fast dentistry is moving.
I remember, I think we used to have a small paragraph, and how it has even increased to new books now. It used to be in the end of the book a very small paragraph.
About implants.
Yeah, and now everything is about that when you come out.
Yeah, so that the problem with is that the curriculum cannot be changed easily, right? It's like a big behemoth, right, from the central government and then to all the institutions. But if that doesn't happen, then students will always be left at a disadvantage, and they'll have to bridge this gap on their own by attending various courses or various seminars. Yeah, and hone their skills so that they can become a good practitioner.
Yes. So, sir, what are you suggesting, that a fresh BDS or MDS pass out should not open their clinic immediately?
Yeah, I believe that is the case. See, let me explain to you how a college works. You also have been a student, BDS student,
Yes,
MDS
sir.
students, you know. But average lacuna which I believe that exists is that I am sent to department in ortho, right? And there I am just taught about the basic ortho procedure that I'm supposed to do. Then I am shifted to prosto where I'm supposed to do dentures and partial dentures, which are no longer preferred by the patients. Then I'm sent to the conservative and endo department where I am given to do silver fillings and which is again not being done in the private practice.
Apparently,
So I am in silos. I am not exposed to the entire dental uh, fraternity in the sense, entire dental, you can say, spectrum where I can have a bird's eye view about the intertwining of all these things. It each and every patient when he comes to you or when she comes to you is not just come for that scaling or filling or that extraction. Now it's a patient as a whole, right? So the doctors need to learn how to plan the treatments, how to diagnose the root cause. Maybe the patient has a pain in one tooth, but the root cause could be something else. So acquiring those diagnostic skills, scheduling the treatment plans in such a way that you get the optimum results, communicating all this to the patients, and the, as you say, inter-branch implications,
yeah.
right, of how perio is important even after doing the crowns, right, or how operative dentistry takes a backseat when you are doing veneers and trying to be more conservative. So all these things has to be kept in mind or has to be learned, which is I believe currently not being done in a BTS or MDS course. An MDS guy learns their specialty in which they have opted for, but what about its linkages to other branches, right? So I believe they have to spend some more time, maybe become an apprentice or an intern in a good practice or attend few courses or seminars and acquire all these skills, and then they should take the plunge.
Basically, the interdisciplinary approach should be clear.
Yes, that's the right word which I missed. Interdisciplinary approach is not taught in the colleges.
That should be clear in their head. Then only.
Even for the BDS, I would say, even they should know the diagnosis and the implications and everything one procedure has on the other branches. So I believe it has to be a comprehensive way of teaching dentistry and not in silos as we have been taught.
Yeah. So a cap patient is just not for prosto. It is also a perio thing that we have to take care of first.
Absolutely.
So, sir, these were about dentistry approach. Now, apart from this, are there any other skill sets that a person needs to acquire for opening up a private
Absolutely, absolutely. So this is just the beginning, right? So you have acquired the dental skills, but when you are into practice, you are providing a service, you are charging the patient for that. So wherein other skill sets also become important. It's not just about doing the right procedure. If you do the right procedure and give very good results, but if you cannot communicate to the patient, if you cannot charge them accordingly, then you will have issues. You will not be able to generate the kind of experience or the revenue that you intend to. So I believe you should also acquire skills like interpersonal skills like communication, right way of communication. You should also know time management skills, how you schedule everything, how you plan your day. You should have leadership skills because you have a team. You're not just alone, right? You have another staff, subordinate staff. You might have a front desk executive or another doctor working with you. So you should have developed those leadership skills, how to motivate them, how to take them along. And besides that, more importantly, financial skills. You should know how, where my money goes, how do I save it, how do I recover it, what aspect gives me better returns, and which procedure is more important that I should focus on. So these all skills have to be acquired. Then only you can become a successful dental practitioner. It's not just doing the best of root canals or doing the ideal crown preparation. That is not sufficient. It's the basic, most important building block, but then you have to learn all these things also. You should also know about, since digital dentistry has come in such a big way, you should also know about the technical skill, technological updates and everything.
Most of us like in that only.
Yeah. Especially a dinosaurs like me, who has never seen all these things. For me to make this change is really difficult.
But you could cope up very well, sir. I'm amazed to see that you have learned everything, the digital world and everything. It's kind of an entrepreneurship.
Yeah. So you should, since we have this era of doctor being looked upon as God or next to God is passing now. We are someone who's providing a service and getting paid for that.
Yeah.
So we have to develop all these skills and see that we provide the best of the service in an ethical manner.
Definitely. If we look at the positive attribute of dentistry, sir, we see every day a new clinic is opening up. And in the same way, if we look at the negative side, there are so many clinics being shut down within a year of practice. Do you have any comments on that, sir?
Yeah, I believe it's just because more and more doctors are graduating, they are passing out from the colleges, more numbers are graduating, as I said, and they feel that they know everything and they should start the clinic. So as we discussed earlier, as a BDS pass out or MDS pass out, you should give certain time, acquire some other skills as we discussed, and then you should start. But if someone has already started, right, they have purchased a place and they have set up a clinic, invested, and now they believe that they are not performing the way they had anticipated, right? They are not getting the patients coming in and getting treatment. See, basically, dental treatment is something about our body. So the patients are going to be very choosy whom they would go to. So it's not like you open a restaurant and you will have people flocking in to taste it and enjoy the meats, right? So you have to have patience. You have to give time. And if you believe that I'm not getting the results even after 1 year or 2 years, then shutting down and relocating doesn't make a difference. What you have to understand is, how do I change myself? How do I improve? You have to analyze where I could correct, what skills I could acquire, what things I need to hone further, so that I give a better experience and get more patients coming into my practice. Besides that, there are many other ways of marketing and branding which can help you in a structured way to achieve this. So shutting down should not be the option. You need to have some patience. And as I said, the journey from a beginner, or I normally say a phase of ignorance, to a phase of detached responsibility, that is the ultimate practitioner, is quite a long one, and your entire life after you pass out from the college might go into traversing this journey. So you should have patience, doctor.
So what are these, can you tell me about this in detail? What are these stages? Is there any?
So what I could say was, one day I was just contemplating about my journey as a clinician. So I realized that when I was in college, how I was, when I was in private practice initially, how I was, what I am now, and where I could be. So then I broadly broke down all this journey of a clinician into 5 phases. I might be wrong. Is this just my idea? It's like a beginner who is ignorant about what his responsibility is towards the patient, right? We are providing a service to the patient. So our responsibility is towards our patient. So when we are in a college, we are not aware. We just have to do what has been asked by the teacher or the head of the department, and we do it without understanding. So that ignorance then comes to indifference. Indifference is when we have graduated, when we know that now I have the license to practice. So we start treating patients, but we are still not aware what are our duties or our responsibilities towards our patients, right? So that's those are the two phases that normally a BDS or a fresh MDS would be going through when they pass out. That's where communicating, developing a rapport with the patient, converting them for treatment, which is right. Still, you might find it a challenge to convert them or convince them for that. So the third, fourth, and fifth stage, I say the clinician with a sympathy, someone who understands the patient's problem, right, and makes him realize that I know what you are going through and I'll get you out of it. That's the third phase. Fourth phase is empathy.
Okay.
So empathy is when the clinician puts himself or herself in that position and feels that no, this is really something which is very concerning and the patient's needs have to be attached, attended to at the earliest. And last is detached responsibility. So in detached responsibility, you realize what you are supposed to do and without getting emotionally involved, which you might in sympathy and empathy. Without getting emotionally involved, you do the right thing in the right way and give the optimum service. So these are the stages that the clinician passes through, right from his student days to the accomplished dental practitioner. And I believe I am still at the fourth stage, maybe. I've still not reached the epitome of being a dental practitioner.
So there is a saying that a person learns from his mistakes.
Yeah.
Is it true that one should make the mistake and then only learn, or is there a shortcut to that?
Yeah. In fact, we cannot do all the mistakes and in our lifetime and get all the learning. Right? That's why we say that we have to learn from others' mistakes. So that's where the students have to be responsive about this. So they have to first identify who's the right person through her. So someone who has not made a mistake in life and has been successful might not be the good role model. The good role model would be someone who has tried 10 different things, failed, and then succeeded. So the learnings would be more from someone who has tried more, who has failed more.
Yeah.
So, and then you apply all these learnings from them and see to it that you do it faster.
Yeah.
So, I always believe that the seniors in your profession should always be respected and efforts should be given to learn from their mistakes and be a better person rather than doing all the mistakes. You might be committing the same mistakes and not even realize that you are doing this. So that's where a structured learning helps you. So you can become or evolve faster into, you can traverse those 5 stages faster.
Yeah. So sum it up, I would like to ask you, how important is it for a dentist to evolve and update with time?
As a human being, we should always think of ourselves as a student, as a learner, and you should never have this feeling that I know everything. Now, when you have that mindset that I am the best, I know everything, I do the best in everything, that's where you hit the roof. That's where you stop evolving, becoming a better person. I have always believed that I should be better than what I was a month back or a year back, and I can only do that if I believe that I have potential to learn more. I need to learn more, and that is an ongoing process. So we have to understand that the dental profession has amazingly transformed in last 10 to 15 years, and those who learned dentistry in the 90s or 1990s or in early 2000 have a lot of catching up to do. So those who will be able to do that, they'll be able to keep pace with the contemporary dental practice that is being followed and will be able to provide better service to the society. So our aim should be, no, I'm not doing it for myself, but I'm doing it for the entire society's good, right? So if I keep doing the old things, I stay in my comfort zone, don't come out of my comfort zone, I'll be the same old person. I'll not evolve, I'll not change, and I'll not be contributing to the society. So ultimately, that mindset has to be developed, that whatever I am now, 1 year down the line or 2 years down the line, depending on your abilities, I would be better Dr. Keval, or I'll be a more evolved Dr. Keval. That mindset is the key. And then whatever profession you are in, if you have that mindset, you will always grow, and you'll always be successful in the end.
So, sir, why don't you make a structured course or something like that for fresh pass outs or anybody who is in need?
Yeah, that thought has come to my mind also many times, but it's just that I still feel that would I be doing the right thing? Would I be countermanding the teaching profession or the colleges? Because I was a part of the college system too.
Yeah.
So there might be objections from the postgraduate associations that why are you doing this? Everyone wants to have their fiefdom, their domain, right? So I am just thinking whether I should.
I think it would rather be a connecting bridge. It will be more helpful because we have seen catastrophic results due to the gap which is there.
Yeah,
So
absolutely. Now, since you have suggested it, it has made me realize that it's more of a moral responsibility for me to bridge this gap. If I know something, I should share it with everyone and see to it that overall level of dentistry improves.
exactly, and it would not just be good for the dental community, also for general well-being that they are receiving at par service everywhere.
Yeah, wonderful. No, wonderful suggestion. I'll definitely work on it, doctor.
So that was me, Dr. Aishwarya Sharma, on behalf of Fine Feather Dental Academy, signing off for the day. For any queries or suggestions, feel free to contact us.